Now, with the aim of tackling the high prevalence of substance abuse and illicit trafficking, the Department of Social Development and the Central Drug Authority will host the third National Summit on Substance Abuse and Illicit Trafficking next week. Substance abuse is seen as one of the growing problems in South Africa, and the stigma associated with it remains a significant barrier to treatment. The event will be held at the Birchwood Hotel and Conference Center in Boksburg. For more on this, we're joined by the Deputy Minister of Social Development, Hendrietta Bogopane Zulu. Deputy Minister, thank you for joining us this afternoon. What are you hoping to achieve with a summit like this, where different stakeholders come together? Well, Minister, I think you are muted.
Oh, my apologies, I muted myself. Well, let me greet your viewers as well as thank you for the opportunity. I think what must be understood is that summits like this bring stakeholders together. The first thing is for us to evaluate the latest, because the world of drugs is an evolving one. It's a moving target. So meeting as different stakeholders, checking up with each other, but also sharing knowledge, evidence-based programs, evidence-based interventions, policies, what is happening in the international world, across the world, what's happening in Africa, and where we stand in terms of measuring ourselves against other nations. So summits like this also gives different government departments, civil society, an opportunity, treatment centers, both public and private, an opportunity to also review whether the policies and legislations we have in the country, are they still relevant? Should we add or subtract anything? But it's also will be serving as a review of the drug master plan, which ends in 2024, so that we can evaluate its implementation, its impact, what are the things that we need to update, what are the things we need to change, but also the disruption of COVID in providing our services. Did COVID drive the numbers high? Did it lower the numbers, access to treatment? What is the impact? Women, children, and just generally our responsibility in the abuse and misuse of tobacco, alcohol, synthetic opiates, and stimulants in South Africa.
Yeah. How prevalent is substance abuse and even illicit trafficking? What are the numbers telling us?
What I can tell you is that just looking at women in the up to 2022 statistics, it's like 40% of women use drugs. For every 5 men, you've got 1 woman, and for every 5 men who use drugs, you've got 2. So I'm one person that looks at the numbers for planning purposes, but I always want to see the human face beyond the numbers, because the numbers in South Africa, not even yourself, you see it at every street corner, at every robot. Those are the numbers. What science does is just to quantify what we already know. And yeah, we are in trouble. That bit I can confirm. And we're not in trouble with regards to, like your cocaines and everything. We are in trouble because of designer drugs. So when other countries are struggling with what you could treat easily, for us, our treatment protocols is also what this summit will be looking at, because we don't know what we are dealing with. Today it's Retex, tomorrow it's what. So drugs that, like your cocaine, your amphetamine, your opioids, which is your pain medication, is the worst abused in South Africa. But they are legal. I mean, let's take it to the human. Think about grandpa, my guy. It's for pain, but it is the most abused, to the extent that it leads to dependency. And it's one of what we classify as an opiate. I like bringing it home, Yabo. Everything for pain, when you abuse it, it's a drug. But we all, you take HIV, you take gender-based violence and femicide, everybody's trying to cope with something. And that is part of the problem.
Yeah.
But also, everybody is trying to get along. I always see myself, probably yourself, as a drug addict in waiting. And if all of us can see ourselves like that, we'll reduce issues of stigma, we'll reduce issues of discrimination, because I refuse to believe that there's one person that just wakes up and says, yeah, today, doesn't happen like that.
Yeah, and I mean, it's not just the ARVs that are now made into these drugs, it's the cough mixtures as well. People are finding new ways to get high. Do you think we've got the right strategies, though, that are impactful, that can deal with also the root causes of substance abuse and not just the consequences?
Yeah, I can say that. I mean, our Treatment and Prevention of Substances Act of 2008, Act 70, it's one of the most detailed legislations around the world in terms of dealing with the issue around drugs. Our drug master plan, and especially this particular one, it's very human rights based. It gives, because it's the blueprint of the country. It tells us what we need to do. It tells us the kind of language, the strategies. The biggest challenge and frustration that we have as South Africa is that our family structure is not working anymore. And I will stress that. The family is at the root of our frustrations. I work with children, and I've been on Newzroom Afrika doing job. We are going to December. Do you know how many children from the age of 3 in January will be alcoholics? Do you know how many children between the 1st of December and the 30th and the 5th of January are going to be initiated in drugs? That is how we must look at it. Children will be drinking, and when they start, our youngest addict in South Africa is 3 years old. I'm not talking about those born drunk in terms of fast, no. I'm talking about those that access alcohol, and we take them to the shebeen, we give them alcohol when they want food, shut up when they cry, and it's an evolving. So we need to understand, for example, you said ARVs. Do you know that even bath salts are becoming synthetic drugs? The Vim, the Handy, you're still talking about like cough mixture. Yes, cough mixture, when you mix it with sweets, you get high. But all of us, when we have a flu, what do? We boil the stony, we put in the disprin, we drink. In our minds, we assume that, no, we are dealing with the cough. But no, South Africa. At that time, you are nicely high, because what you have mixed is a brain-altering substance. The acid in the stony plus the acid in the disprin, they alter your brain. So you're not coughing that night because you are high and your brain has been altered. You are still coughing, but because you're high, you assume that, I'm feeling better and my cough is getting better. There's no such a thing. And that's what we call synthetic drugs. And we need to just know, these are the opiates, these are the stimulants. You know that we are a very depressed country that uses a lot of antidepressants. The introduction of antidepressants are also an introduction to drugs. So that is how complicated our prevention is. And we need each other. We need communities, we need family members, we need early intervention, we need aftercare services. Yeah. Because going to treatment is a problem. The treatment problem at the moment is for women, because women are the highest in terms of drug addiction, but the lowest in terms of seeking help, right? So now, and they don't seek help because as much as that person is an addict, they still think about their children. And we don't have, we only have one facility in Botshabelo that has a mother and child and that's just 20 beds. Then we only have one center that focuses on children, which is in Port Elizabeth. Now, in other centers is a mixture. Now you can think about how many people that are drug addicts that you pass just on your way to work that requires treatment. Fine, we get them the treatment, they get treated for free, we spend 10,000 per week, it's a 6-week minimum program. They go home, they are ready. What do they go back to? To you and me, who don't believe that they have changed. So when I walk into the room, and what do you guys do? We all sitting around the table, everybody reaches for their cell phone. They've not said anything. So nobody believes me. But also, addiction is a lifelong struggle. You can never be cured. So to South Africans, please don't even start. Because unlike other countries where people can experiment, we don't have the luxury. One puff, that's it. You're gone. Because it's a designer drug.
And speaking of communities and society, I wonder what is it that we can do to support those that are addicted. I mean, if we're a country and we want to be free of abuse, we're going to need all the stakeholders to work together, including society, because drug abuse is a societal problem. It's not only going to take your department or the police or the rehabilitation centers. So what do you think societies and families out there can do?
The first thing is that we need to reduce the discrimination and the stigma. Because there's power in language. Whatever we call, that's stigmatization. Therefore, I have no reason to seek help in any event. I'm already labeled. The second thing is that for all of us to spend time listening. Not everybody needs to go to a rehab facility. They are able to stop just by somebody trusting and believing in them. It doesn't have to be a family member. It can be you and me who passes at the robot and mind just a little stop. The other thing is that society and community must actually stop saying every crime committed, it's because of drug addicts. There are a lot of addicts that don't commit any crimes. So we need to also begin as society to de-link the two so that people are able to reach out for help. We need to, as communities, let me start with families. We need to re-look at basic things. Family time, somebody that I can talk to as a young person, somebody that believes in me and gives me the reassurance. Because the other thing is that when you don't get reassurance, you go to the shop because there they give you reassurance. Hang in there and what. And what do? It follows with a coping mechanism. So because there's gender-based violence, your father beats up your mother, it's enough for you. Then Bachana, you tell them the story, imagine there's this. Then what happens? You need to get a coping. They said, my brother, one puff. You get home. For that night, you are high, you don't feel your father beating up your mother. So in South Africa, we need to see the connection. There's gender-based violence, there's HIV, all of the social ills connect, and it is that which the family must fix. Society, we have an obligation to speak out. We have an obligation to provide support. But we also have a responsibility to identify those that are selling the drugs. Because I refuse to believe that I stay in an area and I don't know who's selling drugs. There's no such a thing. We know. But because we want not to take, it's not my child, it's who's child. You don't know. You might be seeing who's child at the Shebeen every day drinking alcohol, which is also another problem. Alcohol is a drug, South Africa, so believe it alters the mind. It's as highly as addictive. So you get introduced to alcohol, what next? One new thing, that we all should look at. Hubbly bubblies. Have you seen how fast those things are growing in our communities? Parents buy those things for their children. And those things, flavorant and what, one puff of a hubbly bubbly equals to 70 cigarettes. But also, it's crystal, it's liquid cocaine that's flavored. And then we are sitting here, all of us are seeing hubbly bubbly, even 2-year-olds pulling hubbly bubbly, and everybody justifying. No, it's just flavored whatever. My guy, it's not. Now ask yourself, where are we going and what's going to happen to us?
Yeah. Deputy Minister of Social Development, Hendrietta Bogopane Zulu, I appreciate your time this afternoon.